Hi, you're noticing that your lips are thinning or you're losing support around the mouth, but you're really nervous about lip filler and looking unnatural. That's one of the commonest things people say to me, and they notice over time these little changes happening, and we call them smoker's lines or barcode lines. And they happen because that skin is losing elasticity over time from sun damage. The muscles are getting more active and pulling tighter, and we're losing fat and we're losing dental and bone support. So the area is complex. One of the things that's really important is to pick a medical practitioner so that you're getting somebody who's really skilled with a good knowledge of anatomy, and they'll assess your face as a whole rather than just going straight for the lips. Ideally, if you have somebody who uses ultrasound, that's amazing because we can scan the individual anatomy. That's always different from textbooks. You want to use the right products. I use a fair amount of Juvederm, and I do some consultancy work for the company, but I also use other brands. But I like some of their very soft, runny products because they'll give me hydration and they'll give support without bulking the area. You want to have the right technique. I use a little blunt tool called a cannula, which doesn't look very nice, but it's not sharp. And I can make a little hole with a needle outside the lips on each side, and then I can sneak this little gadget in slowly and lay down tiny amounts of the product and mold it. We can then refine it with tiny needles along the lines if we need to. We use ice, we use numbing cream. The products have numbing in them, and I use little squeezy stress balls like this little one. And we also use a little T-bar vibrator tool, and I can use that in a clean glove on a different area of the face, which helps distract from the discomfort. On a scale of 0 to 10, if 0 is pain-free and 10 is terrible pain, the discomfort is about a 1 to 2, but we go very slowly and gently and we take plenty of time. The results can last 1 to 2 years depending on the product and how much we're putting in, and we want it really natural, and we'll mold it and put on a lip balm afterwards. It's important to have a face fully clean of makeup so we can see the blood supply from the lips as it goes right up into the forehead. So I don't like when I see videos with just this area cleaned. You need to have a completely clean face. You can get tenderness, you could get bruising, it can be swollen for a few days, but we give people an ice pack going home. And you must have a follow-up number for your medical practitioner so that in the unlikely event of a complication, you can contact them for support. The results really are very natural if the technique is right and if the right amount of product is put in, and they can last a long time. I had some product, which was the Volite, in my lips 2 years ago from a colleague. It's still fine. I did have a little bit of support around the lips as well, and your skincare is important. Things like SPF every day, retinol and vitamin C can help strengthen the skin. You can do tiny doses of botulinum toxin along the lip edge and a tiny bit at the bottom, and that just relaxes that muscle a fraction and turns out the lip, and it looks a little bit more supported. But for really deep in edged lines like this, botulinum toxin isn't going to work. That's a prescription only medicine, and you have to be assessed for suitability. So the changes that are happening is this is areas lengthening, the lips are turning in, they're thinning, they're losing support, we're getting lines. Men get away without this because their area of hair-bearing skin in the beard area, the skin is much stronger, and that helps prevent some of those changes that we see as women. So do your homework, try and pick somebody reputable who will look after you really carefully, assess your whole face and not just go straight for the lips, and feel free to get in touch with any questions. This lady's picture is here, she's happy to share, and you can see we got a very subtle result, and she was very happy with that. This is her before and immediately afterwards. She will get a bit of swelling, but hopefully she will get a really nice long-lasting result. Take care, bye.